Good afternoon, everyone. Good to see everyone today. I want to begin by just saying thank you to all the good people of Arizona. It's been an incredibly difficult several months, I think even increasingly so over the last couple of weeks. So I want to say thank you to all the peaceful protesters, all the law enforcement leaders, all the cops and deputies, and our healthcare workers who have all been working overtime. Thank you for what you've done, and I want to give you an update on where we are in Arizona around COVID-19. So we're going to continue to take a calm and steady approach. The urgent action and decisions we're going to make are going to be to protect public health. And everything that we talk to you about today will be informed by data and information, and we want to make sure that you have accurate data and information. Let's review just briskly how far Arizona has come in the last 3 months. On March 11th, 2020, there was a declaration of statewide emergency that was made from the governor's office, and our first executive order was to protect Arizona's most vulnerable communities. On March 19th, we had an executive order to halt elective surgeries. If you remember, the focus at that time was around personal protective equipment. There was a real concern around the shortage of that, and that happened in mid-March. On March 26th, COVID-19 was declared widespread in our communities and has been widespread since then. We also put out an executive order to increase hospital capacity. This was the pandemic preparation for what could be a worst case scenario. So we required hospitals to activate their emergency plans at the end of March and to increase bed capacity by 50%. On March 30th, we received $10 million in grants for ventilator purchases, 600 additional ventilators available for use in July. And the Stay Home, Stay Healthy, Stay Connected order was put forward on March 30th. The objective of that order was to slow the spread of this virus. We were watching what was happening in New York and Louisiana and Michigan, the Eastern Seaboard, other places that were hit first and hit hardest, and we were preparing if that were to come our way. So the idea was to reduce the number of new cases from one day to the next to help prevent the healthcare systems from becoming overwhelmed. On April 9th, we began to put forward what could be surge capacity or field hospitals. St. Luke's Medical Center was added. On April 22nd, we were able to resume elective surgeries because we had our arms around the PPE issue in the state of Arizona at that time. On April 23rd, we were able to launch the Arizona Surge Line. This is a 24/7 toll-free call line that facilitates the interfacility transfer of patients to balance hospital resources should that be necessary. This was implemented in New York State on March 31st, after the state of New York had reached 75,000 cases. In Arizona, we were able to pre-plan because of where we were, and we were able to launch this at 5,769 cases. And we developed it, of course, with the leadership of the Department of Health Services. Dr. Cara Christ is with me today, and with Arizona's leading hospital professionals. So, when we declared the emergency in March of 2020, our insight into hospital capacity was limited. Today, we have daily reporting through enhanced surveillance and ongoing capacity increases. We know to the bed where we are in the state of Arizona. ICU beds in mid-March, 1,532. Today, 1,657 plus 600 additional surge beds that would be available as needed. and today they are not needed. Hospital beds, 1,532. Now we have 7,652 plus a 2,600 additional surge beds available as needed. And ventilators, we knew where 330 were on March 11th. Today we've got our arms around 1,684 ventilators, plus an additional $10 million in state-issued grants for additional 600 ventilators. So let's talk about where we are in Arizona today on our statistics. This is the White House gating criteria informed by the Centers for Disease Control. We're going to take you through symptoms, cases, and hospitals. Those of you that have been following these press conferences will know this is the same framework we've been working through for 4 months. On symptoms, we want to see a downward trajectory of influenza-like illness within a 14-day period, and a downward trajectory of COVID-like cases within a 14-day period. The blue line represents COVID-like illness surveillance. The gold line represents influenza-like illness surveillance. You can see on the y-axis the stay home, stay healthy, stay connected order. This metric has been trending down to flat. We've seen de minimis increases from 1.4% to 1.5%, 4.4% to 4.7%, and 4.8%. This is a metric we will continue to watch. Let's talk about cases. We want to see a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive cases as a percent of total tests within a 14-day period. This is COVID-19 cases by day. What you see here is a clear increase in cases. Now I want you to hold this increase in cases in your mind as we go to the next slide, where you are going to see a clear increase in testing. The blue represents our testing surge and a dramatic increase in testing. So we've got an increase in testing resulting in an increase in cases and also an increase in positive tests. The increase in positive tests is not the direction we want to go. We want to go in the other direction. So this will continue to be a metric to watch and measure. Now, when you think about this increase in testing, resulting, along with some other factors, which Dr. Christ will touch on, but the increase in testing resulting in an increase in cases, along with an increase in positivity, what we want to measure, what's most important, is where are we today in hospital capacity. That was the reason for the stay home, stay healthy, stay connected order, to slow that spread so that we could treat all patients in Arizona without crisis care. These are our hospital beds. Now, this does not include the 2,600 additional surge beds. Blue represents inpatient beds in use. Gray represents inpatient beds available. So I want you to see the total picture, and on this next slide, we will overlay the COVID-19 cases in Arizona. The COVID-19 cases are in gold. You will see a tolerance over the last several weeks of between 14 to 16%. We have capacity in our hospital beds, and you do see an increase in COVID-19 cases here. Intensive care unit hospital beds. This is if you get extremely sick. We want to make sure we've got ICU beds to care for you. This doesn't include what we can do in surge capacity of an additional 600 beds. The blue represents ICU beds in use. Gray represents available beds today. This next slide will overlay COVID-19 cases. You will see that the COVID-19 cases hover between 23 to 26% of ICU beds. We have capacity in our ICU facilities in Arizona, regardless of what you are extremely sick with. This is intensive care unit beds. Gold represents COVID-19 patients. Blue represents ICU beds in use by non-COVID-19 patients. You can see the number of patients from May 15th to June 10th. I think it's fair to say that these are fairly flat lines. We have capacity in our intensive care unit hospital beds in Arizona today. Ventilators. If you get extremely sick, you may need a ventilator. Blue represents total ventilators in use. Gray represents ventilators available. I'll overlay the COVID-19 numbers in gold. You can see we have a lot of ventilators available in Arizona. We have access to more ventilators if necessary, and the COVID-19 number has remained pretty flat for ventilators. Arizona hospitals are prepared, and you don't have to take it from just me. You can take it from Arizona hospitals, including Banner Health, Dignity Health, Honor Health, Abrazo, Carondelet, and Northern Arizona Healthcare. There's been a lot of misinformation out there. It's important that we have the facts straight on where we are in hospital capacity in Arizona, because our citizens deserve to have the facts. Recently, there have been local and national media reports regarding the increase in confirmed positive COVID-19 cases in Arizona and how our state is managing the COVID-19 crisis. As representatives of the largest health systems representing 80% of care provided in the state, we'd like to assure the public that we have the available bed capacity and surge plans are in place to continue to serve the people of Arizona. We are well prepared to manage an increase in patient volume. It's important that people know we are not seeing an increase in patient volume. We are prepared if that increase should come. The facts are we've got an increase in testing, an increase in cases, and an increase in positive test results. So we're going to continue to stay laser focused on COVID-19 in the state of Arizona. We're going to do more testing to know where we are every day, and I really want to applaud our private sector partners and Dr. Christ and the Department of Health Services for the robust testing program that we do have in place today for our at-risk healthcare workers, including antibody testing and trace contacts of COVID-19 results. This is our testing by day. You can see supply chain was an issue. Also, other states were getting hit before we were hit. They were getting hit harder. We've been able to have, I think, our 6th straight weekend of a testing blitz. This is all labs in the state of Arizona. Over 429,000 tests have been conducted, 309,000 plus in terms of diagnostic, and 120,000 in serology. You can see that we have had days in Arizona of over 19,000 tests conducted. Just a few days ago, 12,383 tests conducted. So we have a global pandemic, and of course it is impacting our nation everywhere, including Arizona. We put some states on here, some of the states that were making national news early in terms of the cases that they've had and the cases per capita. We talked a lot about New York State and learned a lot from what New York State went through, and Massachusetts and Baton Rouge and New Orleans specifically. You can also look at where Arizona is in comparison to some of the western states. It gives you a focus on data and information that we follow and track every day, wanting to make the best possible decisions so that we continue to slow the spread of COVID-19 in Arizona and protect our citizens. So some of the national trends that people I want to be aware of is in the past week, 19 states have seen a new rise in cases over the past week compared to the previous week. In the past week, 8 states have reported a 50% increase in COVID-19 cases from the previous week. And since the start of June, 14 states have recorded their highest ever 7-day average of new cases. We're seeing increasing cases. We're going to continue our gradual and phased-in reopening. We will balance public health with public safety, and we'll increase our testing and our contact tracing. We're also going to increase in terms of hospital capacity on whatever will come next. We're prepared today, but we're vigilant every day and focused on this every day. Of course, we've been discussing some other things in the state and in the nation, but in terms of top priority, public health has been top of mind for my administration, and it has been Dr. Christ's entire focus. What people need to know today is we have capacity for COVID-19 hospitalizations or non-COVID-19 hospitalizations, regardless of the level of care that you would need in the state of Arizona, anywhere in the state of Arizona. Arizona has capacity. We're going to increase testing. Our testing in Arizona has doubled since the stay-at-home order expired. On May 15th, we were north of 146,000 tests. Today, we're north of 300,000. Testing has increased by more than 500% since April 15th. We were at 47,000 plus PCR tests on that date. Today, again, 309,273 tests. We want to return smarter as a state. We know so much more about COVID-19 today than we did on March 11th. Yet, this is a virus we will continue to stay focused and vigilant around. And with that, I want to turn it over to Dr. Cara Christ, who will give us an update.
Thank you, Governor. So we've been talking COVID for a couple of months now, and we want to remind that every Arizonan can do their part. So we know that COVID-19 is still widespread in our community. One of the things that we encourage Arizonans to do, especially if you are vulnerable to the potential bad outcomes of COVID, if you are over the age of 65, or you have an underlying medical condition that puts you at risk, we want them to limit their time away from home. You want to make sure that you physically distance when you are in public. Try to stay at least 6 feet away from others. If you cannot physically distance, we want you to wear a cloth face covering. We encourage everyone to wash their hands for at least 20 seconds with soap and water, or to use a hand sanitizer, especially after touching your face or even moving your mask. You definitely want to make sure that you're using hand sanitizer. And then to stay home when you're sick so that you don't spread it to others. We're asking that all Arizona businesses do their part. So in the Returning Smarter executive order, it does require Arizona businesses to develop, establish, and implement policies, including physical distancing and disinfecting protocols. And that's based on guidance from the Centers for Disease Control, the Arizona Department of Health Services, the Department of Labor, and OSHA. And what we ask them to do is to implement protocols that will help individuals stay physically distanced at their workplace, or if they are out in public, it encourages them to do symptom screens of their employees when they come in, and other things to prevent the spread of the disease. To date, we've implemented mitigation strategies, and we've been looking at, we have implemented mitigation strategies. So we've limited restaurants and bars. We have suspended visitations to long-term care facilities because we know that those are filled with those that are vulnerable to the disease. We have halted elective surgeries and allowed facilities to request exemptions from that executive order, and we have issued a stay-at-home order. And the goal for those mitigation strategies was really to slow the spread so that we could ensure that we had adequate hospital capacity. We know that it's in the community. We are not going to be able to stop the spread, and so we can't stop living as well. One of the things that we have been paying attention to is those unintended consequences of what a prolonged mitigation strategy could be. So we weigh the risk of the virus with the risk of those long-term public health impacts. And we are seeing some detrimental impacts on things that are very important to public health and could lead to long-term health effects and consequences. So one of the concerns is child safety. We want to make sure that those children that are high risk for abuse have somebody else who is laying eyes on them. We know with the stay-at-home order and the closure of schools that has reduced significantly. We also know that the learning impacts that children can have not being in the classroom and not having that continuous learning environment can result in education impediments. The mental health impacts of a stay-at-home order, including the financial and emotional stressors that come along with the stay-at-home order and closure of the economy. And then loneliness and isolation. And I'm sure you all have heard us talk about that at the Department of Health Services, but we feel that there is a loneliness epidemic, and so this has contributed to that as well. There are physical health impacts of this. We have noticed that there have been decreased cancer screenings statewide. We are aware that there have been decreased childhood immunizations because children have not been going for their well-child checkups. And we also have concerns for those victims of domestic violence. So an update on our long-term care facilities. By the end of today, we are scheduled to complete all of the facilities that we will be doing the testing for, except for 2. 40 facilities are coordinating their own testing, and so far, 15,000 staff and residents have been tested. For corrections, we've updated on this before, but the U of A serology testing is available for staff and contractors, especially those that have direct contact with the inmates. That is available if they want to go get testing. There's 31 University of Arizona serology testing sites statewide if people wanted to go get tested immediately, but we are working with Sonora Quest to go on site to complete that specimen collection for those that may not be able to travel to one of the University of Arizona on-sites. Those will be run by Sonora Quest. We have been working with UMA to provide diagnostic testing in response to some cases that had been identified at the UMA complex. And then we are working with the Department of Corrections to implement infection control surveys and are currently going out on-site to the facilities to review those plans.
Thank you very much, Dr. Christ, and I want to ask Major General Mick McGuire to please give us an update on the Bighorn Fire, and I also want to say thank you to you and the brave women and men of the National Guard and all the hardworking folks at DEMA that are working on fighting fires and peaceful protests and every other issue that comes the Guard's way. I'm very grateful for what you've been able to do. Will you let people know what's going on with the Bighorn Fire, please?
Yes, sir. Thanks, Governor. As it pertains to the fire burning in Pima County that originated in the Push Ridge area of the west end of the Catalina Mountains, we are coordinating with Pima County Emergency Management. As many of you have heard me say before, we are always in support of the incident and the incident command system. The incident command system there through U.S. Forest Service has asked for an evacuation of a number of areas, and I would direct the media to the PIO running the incident down in the area about the specific locations, but essentially it is the northwest sector of the Catalina foothills area in the Tucson sector. As many of you know, we had a fire here over the 30th and 31st of May where we lost structures. So we have had, unfortunately, some experience with getting folks into non-congregate shelter, a technique we wouldn't normally use, but the COVID-19 situation has forced us to do that. Thank the Red Cross and all the groups that step up to help with those things. And we pray that they don't lose any structures down in Pima County with this one, sir. Thanks.
Thanks very much, Major General. Let's talk about our plan going forward. The plan going forward is we're going to continue to focus on public health and the education campaign around it. Physical distancing, washing your hands, staying home if you're sick, and wearing a cloth face covering when you cannot physically distance. We'll continue to increase testing in the state of Arizona, which will give us more sightline to what our situation is at the state level. We'll have a constant focus on cases and hospital capacity. We've got a team of 44 experienced epidemiologists tracking the data in real time, the number of cases, and measuring the hospitalization rates with continued surveillance, and load balancing of our hospital resources. And we're going to prioritize where the risk is highest in Arizona. It's our skilled nursing facilities, our long-term care, and our prisons. And with that, we'll open it up for some questions.
Governor, thank you. Billy Harfosh, iHeartRadio. Governor, I keep getting the same question from people out in our community, and I just want to make sure we're clear. As long as hospital beds and hospital capacity is not in jeopardy, do you plan on keeping the phased opening, or have there been talks behind closed doors to take a step back? Because people are getting sick, and I understand there's more testing, but there's more sick people out there as well. So just to be clear, as long as hospitals are okay, you're going to keep the phased opening approach.
So I want to answer the question, Billy. The focus has been on slowing the spread, on making sure that we had hospital capacity so that we could provide care and comfort for people that needed it. We will continue to focus on that. Where we are today is remaining vigilant, but we have seen an increase in caseload. There has also been that increase in testing. I've said several times, I want to maintain every option available to a governor to protect the people of Arizona. That's my top focus. If you were thinking of the stages of how we got to where we are today and gone in reverse order, the first issue, if necessary, would be around elective surgeries, which we are able to conduct today in Arizona hospitals. We've been able to resume those, and our surge capacity inside the state of Arizona. I do think we can, as we moved into phase one, I said that this is a green light to proceed, not to speed. We did have several weeks of positive metrics heading in the right trajectory. Now we're seeing some numbers that we want to pay attention to and see if those increased cases result in increased hospitalizations. We haven't seen that to date, but that's what I'm focused on every morning and every evening.
We'll go to Dennis and then we'll move across. Come on down.
Yeah, Governor, you spoke a lot about capacity, ventilators, tests, those kinds of things, but obviously treating COVID is more than just machines and whatnot, ICU beds. What about doctors and nurses? I know that you cut regulations early on so you could access more because you were worried about them being in short supply. Can you guarantee Arizonans that there are enough doctors and nurses to handle this current surge in cases?
Well, first, I want Dr. Christ to talk about where we are right now on doctors and nurses, and then I'm going to talk about the relationship that I have with other governors across the country in a worst-case scenario, what would be possible for Arizona. But will you talk about our current status in Arizona today?
So currently with our doctors and nurses, we do have capacity. Now, if the cases were to increase, hospitals have surge plans or emergency preparedness plans that outline a number of tools. One of those tools, if they cannot, if say a bunch of the physicians or nurses got sick and they called off, they can request additional resources through their county health department. The county health department can bring it up to the state health department if we need to. We could recruit volunteers through our ESAR VIP resource, and then we can also request federal resources to come in and provide additional staffing if we need.
The surge plan, so according to your own reports online, though, that means reduced care for everyone. That means people get discharged a little bit earlier. Nurses, the nurse-to-patient ratio gets worse. So that means reduced care, correct? And
So no,
how far are we from surge?
It does not mean reduced care. So there are practices that we can put in place to ensure that we have adequate staffing, but it ensures that the patients are at the appropriate level of care, receiving that level of care at that time.
Do you have numbers to provide us about doctors and nurses to assure the public that there are enough people there to handle this?
I don't have the numbers on that.
Nicole, we'll go to you and then Howie.
Excuse me. Governor, for you, there's concern that you're tone deaf to the spike in cases as national health experts across the country right now are voicing concerns that the virus growth in Arizona has gotten bad. You say a rise was expected, that we have hospital capacity. Are those people sounding the alarm? Are they wrong? And when will you act? What is your plan if we keep going the wrong direction, besides using the tools in the governor's toolbox?
Well, first, I want to say that this is something that we've been focused on every day since March 11. I would say since January 27th, when we stood up the Emergency Operations Center at the Department of Health Services. We've been preparing for what would be our time for an increase in cases and an increase in hospitalizations. And part of the reason that I wanted to share the statement from the hospitals and where they are from a capacity perspective is this is what we have been in preparation of, is that we can care for Arizonans that need it. We can provide them the hospital care and comfort and attention. And today, we can do that. We can also do that for what we believe is the foreseeable future, and the entire time we've been focused on a possible worst-case scenario with surge capacity for hospital beds, ICU beds, and ventilators. Now, those are not needed or necessary right now. You know everything that I know. I'm working with subject matter experts on this that are focused entirely on the state of Arizona. And we're going to continue to stay focused on it.
At what point, what will it take for you to admit or be convinced that you let your stay-at-home order expire too soon? What will it take?
So this has always been about saving lives, and it's also about livelihoods in the state of Arizona. We put the stay-at-home order there so we could prepare for what we are going through right now, and we are prepared for it. And I want to thank Arizonans. They've been asked to do a lot. They have sacrificed a lot. The behavior and responsibility has been outstanding. I think we need to redouble our efforts on this because this is not yet behind us. We're navigating through this, and we're going to be able to do it. The global pandemic has affected the whole world, but it hasn't stopped the world from turning. We're going to be able to do this in a balanced and responsible way for the people of Arizona, and we're going to stay committed to getting through this storm, no matter how long it takes.
But at what point will we see a plan of
I just showed you a plan at the end of the PowerPoint deck.
Howie, you up next?
So I'm listening to what you're saying. Governor, you said, we've seen an increase in cases, we're going to continue our gradual reopening. And Dr. Christ...
No, I didn't say that, Howie. I said we've seen an increase in cases. I did not talk at all today about any additional reopening.
Well,
There's no, any reopening would be gradual. There was no opening announced today.
okay, and then I heard Dr. Christ say, we're not going to be able to stop the spread. We can't stop living. Sounds like you guys have given up in terms of anything to say, well, here we are, we're not going to require face masks, we're not going to go back to stay at home. It sounds like you've given up and just said, well, we got the economy, so, we'll just live with it.
Howie, nothing could be further from the truth. We're 100% focused on the proper decisions for the state of Arizona, and we're going to continue to make those decisions. The fact that I'm demonstrating of what 3+ months of work to have available hospital capacity, to be focused if there were to be a worst case scenario. And the fact that that worst case scenario is not here today is positive news. So we're going to stay focused on this. We want people to make responsible decisions like they have so far, and we're going to be able to navigate through this. I think it's important that people have the facts. This virus is not going away. There's not a cure for this virus, and there's not a vaccine for this virus. So this virus is something we need to learn to live with, and we need to make sure that we are protecting the most vulnerable in our society, and those are folks at a certain age bracket with underlying health conditions and at-risk conditions, and we're going to continue to do that every single day until there is a vaccine.
So let me follow up. I'm reading from Dr. Christ's blog here. Wear the cloth face mask in public regardless of whether you feel sick or not. That way you're protecting yourself, your family, and others in the event you're infected and don't have any symptoms. When was the last time you wore a face mask, Governor?
I was in, well, first I want to say I'm all for face masks when you can't physically distance. I've got my face masks with me today, and when I'm not physically distancing, I wear them and wash them often. Cowie, can I answer the question, please?
Sure.
I mean, I've listened to your question. Can I give you an
Sure.
answer? Okay. Even on the CDC guidance, it says it can be difficult to physically distance in places like pharmacies or grocery stores. I was in Walgreens picking up some things on the way home, and I've been to the grocery store. In both places, I wore a face mask, and face masks are good. So if you can't physically distance, wear the mask.
We're going to go to Zoom next. We're going to hear from Hank Stevenson from the Yellow Sheet. Hank, go ahead.
Can you hear me all right?
Yes, we can.
There we go. Considering we're seeing a spike across the state, but particularly we've got some hot spots, why don't you allow cities, counties to enact their own local regulations that go above and beyond what the state is doing?
Thank you, Hank. We've been following the White House gating criteria along with the Centers for Disease Control. It does give us the option to do things either statewide or county-wide. To date, we've been able to accomplish the objectives to protect and care for the citizens of Arizona with statewide guidance, but that will remain an option. And if it were necessary for any county, we could do that. And do you want to touch on some of our hot spots and where we are? Can we? I want to. Hank, let me. Hank.
If I could just.
Can we finish answering the question?
Counties are asking for this authority.
Yes, thank you, Hank.
We're handling it at a statewide level, but I don't think that people in Yuma, Tucson, a variety of places around the state would agree with that.
Do you want to talk about it from a public health perspective, Doctor?
So as we look at the hot spots around, we know that there are a couple of areas where we are seeing increased cases. We are seeing increased cases in Maricopa County and the central region. We are seeing cases down around our southern border. We do know that there are increased cases across the border in Mexicali and Sonora that are diverting patients up north to Arizona. And so we have been monitoring that situation, as well as the hot spots with our tribal nations.
Thank you, Doctor.
what about, we're gonna go, we're gonna go over to this side of the room. How are you guys, Telemundo, please, from the other side, please.
I have about two questions. So the first one is, a lot of us are out on the street reporting, seeing, what's happening in the community. I personally see a lot of people out in public, they're not wearing masks. A majority of them are not. They're not following the guidelines. So if the cases are going up, if we see hospitalizations going up, then are you going to make it mandatory to use them in public and in private areas? Is that an option at all?
What we want to do is do a better job with the things we were doing a good job before the stay-at-home order lapsed, and masks are one of those. I hear from different folks that they'll say no one is wearing masks. I want you to know, when I went into Walgreens, every single person was wearing a mask inside Walgreens. It wasn't everyone at the grocery store, but it was the overwhelming majority of people that are wearing masks. There are some people that can't wear masks for whatever reason, shortness of breath, or they are asthmatic. But we want to do a better job from a public health communication standpoint, that masks are a good thing. When you can't socially distance, wear a mask, wash your hands. Those types of things go so far in reducing the spread and improving the situation here. The only thing I want to challenge here is we are seeing the increase in cases. That's a fact, along with the increase in testing. Our hospital capacity we have that capacity today. I think that's important because there, for whatever reason, was a lot of misinformation out before this afternoon.
So as of now, you don't consider making it a mandatory thing, for public areas at all?
I want people to wear masks when they can't socially distance.
Just quickly, I want to make sure, because Hank started asking a question, or there were questions about local. Why not allow Coconino County health officials, or Maricopa County health officials, or Santa Cruz County health officials, or City of Phoenix, or City of Tucson health officials to make their own decisions based on that? You've often said the government closest to the people is best. Why not let them make the decisions?
And I will continue to believe that the government closest to the people is best, except in a global pandemic. We want to have clarity and consistency for our citizens, and we want to reduce the confusion that's happened across the state and across the country. It's a difficult time. Many things are changing. We retain the option to make decisions at the county level if necessary. Every decision that I've made has been informed by public health. It's been statewide, and that's where we are today.
Governor, certainly the increase in testing has played a significant role in the increase in confirmed cases we're seeing. But we've also seen some other numbers here, in an increase in total hospitalizations by day. It's a pretty steady increase in the percentage of positive cases for probably the past month or so. And according to the two-week average that Johns Hopkins University keeps, we have the worst positivity rate of the 50 states. I mean, are these signs that it's not just increased testing and the outbreak is genuinely getting worse here?
So do you want to talk about the increase in positivity, and I want to talk about the increase in testing?
Sure. So we continue to monitor. We have noticed an increase in the percent positivity. We do know that there is community spread. We are going to be working on trying to bring that back down, and that will include a public health education message. We do know that we've got a lot of testing going on, and when you start to get increased cases, you're going to have a higher percent of those tests come back positive, and those people are seeking care, which is getting them tested because they're developing symptoms. Some of the things that Arizonans can do to make sure that they don't spread is to wear a face cloth or a cloth face covering when they cannot physically distance, and to make sure that they're staying home when they're sick. The other thing that you can do is you can symptom check yourself before going in to make sure that you don't have a fever, that you don't have a cough, shortness of breath, those types of symptoms, because you may have COVID then.
Okay, according to the Johns Hopkins numbers, we're also still near the bottom of the 50 states plus DC and Puerto Rico in terms of per capita testing. Is that a problem? Why is that the case, and what's being done to remedy that?
So we continue to add sites to our website. Anybody who wants to go get tested can go to azdhs.gov/ I think it's COVID-19 testing, but it's on our homepage, and you can go to that website to find it. We have 123 sites where you can go get tested. While at the beginning, we had a supply chain issue with getting the testing for supplies, and there was a lot of demand. As we've gotten more testing supplies and testing availability into the state, we have not reached the full capacity. We are not using, so there's not Arizonans like trying to fill the capacity for the tests.
Meaning that we have supply. So this began with healthcare workers and folks that were on the front line, doctors and nurses and emergency medical professionals. And then we went to people that thought they had been exposed to COVID-19 or may have COVID-19. Now, if you want a test, get a test. We've got a test available. We've got over 120 plus locations, and it will help us inform better data-driven decisions.
We'll go to Matt and then Jason.
Governor, it's I guess kind of twofold. One of the things you keep emphasizing when you talk about capacity is today. I guess, how concerned are you, because we'll probably agree that if somebody were to get sick last week, we probably won't see those testing numbers until next week, you know? So how concerned are you about the protests causing a spike, and how confident are you that we will still have that sort of capacity in 2 weeks or July?
So, Matt, I think it's twofold. One is in the reopening of our economy, Arizonans were great, staying at home, staying healthy and staying connected. But we're starting to see more activity in our economy. We saw some of the gatherings that happened over Memorial Day. Of course, we've seen some of the gatherings that have happened for a righteous cause. A lot of young people in those crowds, which is good news. Saw a lot of masks in those crowds, which is good news. Didn't see a lot of social distancing. So we need to be prepared, come what may. And this wasn't just in Arizona. This was across our nation. So it is something that, of course, we're aware of, that we believe we're prepared for, but we're going to remain vigilant to monitor these numbers. And I would say to anyone out there who has been exercising their constitutional rights and having their voices heard, if you wanted to take a little bit of time this upcoming weekend and getting a test, probably be a pretty good idea.
You're recommending that protests should go to the test?
I want, because now we have capacity, because we're going to complete our long-term care facilities and state prisons, because we've been able to get our healthcare workers. Now, if you're curious, get the test.
Jason.
All right, Governor. You've made clear that we have enough beds, we have enough ICU beds. Everybody's seeing the numbers of cases going up and the hospitalizations going up. Is there a point where, is that the key, the number of beds and ICU beds available, where it's the tipping point where if it gets too high and we have too few beds available, that's when there's a reevaluation as to whether or not we need to put in some other mandatory steps, other stay-at-home order? Is that something that we're not there yet, but is there a tipping point where you got to say, okay, we need to reevaluate at this point? Is that the key with the beds available?
Jason, certainly. We try to think of how do we mitigate this, how do we decrease it, how can we someday bring it to an end. But between now and then, now and a vaccine, we need to be prepared for whatever may come our way. We have said that in Arizona, we believed peak illnesses and hospitalizations would happen in this June, July. I think Dr. Christ has even said August timeframe. So we're navigating that. But we also know that this virus is going to return in the fall. And we want to be prepared for whatever may come. And we're going to continue to do that.
So really quick, you say there's capacity statewide. What does it look like for capacity in various communities? Yuma County, obviously a lot smaller in population and in capacity than Maricopa County, for example. Does that mean patients might have to be transported out of their counties to get help? And if so, how could that be facilitated? Is that something that private ambulances do? Is that something the state has to help with to get people the treatment they need if they can't get it in their backyards?
This situation of global pandemic inside our state is all hands on deck and all resources on deck. You saw the National Guard surge to Navajo Nation with Black Hawk helicopters and emergency medical personnel because that's what was needed. That was what was necessary to provide comfort for our people. That's why we put the surge line in place, so that no matter where it is in our state where there is a capacity or medical facilities are needed, we can get the citizen where they can be cared for. And that's something we've been planning for since March. I don't know that we've had to use it all that often. The most dramatic example is in Navajo Nation, but the areas that you're talking about where we are monitoring very closely the spike in cases, we've got all hands on deck, whatever we would need in terms of transport. And that's before we talk about surge hospital capacity or field hospitals. Anything to add, Doctor?
No, that was
Real quick, then, contact tracing, what's the state's efforts on contact tracing? We've heard from Maricopa County. Want to ask that one?
Please.
So for contact tracing, Arizona, our local counties are the boots on the ground. And so they are the ones primarily responsible for the contact tracing. And they do this for a number of diseases, including sexually transmitted infections, measles, those types of contagious diseases. For the state, in order to support our counties, we have developed a statewide surge capacity for contact tracing. So we have implemented a contact tracing program where patients or people who are potential contacts can get enrolled. It sends them reminders. It asks them to check their symptoms every day. It follows then back up with the county health departments if somebody is symptomatic so that they can arrange testing. That has been adopted by all 15 counties and some tribes statewide. And then we have brought on a capacity through a call line as well as being able to bring on additional staff so that if the counties need additional support, either boots on the ground staff, a calling staff, the state can support them through that mechanism.
I'll go to Andrew next, and then we'll come back over here.
Governor Doug Ducey, you previously indicated that with increased testing, we could expect more cases to pop up or more positive tests. Are these the numbers that you expected to see at this point with this level of testing? Are these the numbers that you expected to see at this stage of reopening?
So we did expect to see increased numbers, partially because of the increased testing as well as people being back in the community, and we know that COVID is in the community. I always try not to guess what those numbers are going to be just because it's very hard to predict. We do know that it is in the community. And so I don't know that I had an expectation.
And what I would add, if you remember, it was several, I think, months ago now, but I was asked if we had wasted taxpayer dollars on St. Luke's because it wasn't apparent at the time that we would need it. I mean, that's part of the investment in being prepared for a worst-case scenario. We're not seeing that in Arizona, but we've got that standing up as a warm facility, along with additional facilities if needed. And that's that planning around a worst-case scenario, which we are not experiencing.
Were you expecting this level at this point, like you said?
You plan, what you do is you expect the worst, and you are prepared for everyone. Was looking at what was going on in New York State and other places around our country that were getting hit incredibly hard. We learned a lot from those situations, and I will tell you, while there wouldn't be indication in terms of our hospitalizations today that that's where we're headed, we will be prepared for whatever happens to the state of Arizona. That's what we signed up for.
Sir, you entered today as the governor of the state with one of the two highest levels of infection rates. I and the audience, I don't think, have yet heard one thing that will change that. Have we missed something? I
have indicated what's important to care for the people of Arizona. This virus is in every state in the country. It's in every county in our state. we're going to continue to mitigate it. We're going to be able to care for people who are sick. We want to, of course, reduce and eventually eliminate it. I put up numbers where Arizona compares in terms of other states. We want to make the best decisions for the state of Arizona, and we'll continue to do that.
A month ago, we had a positive rate of 1 in every 20 tests. This week, we have a positive rate of 1 in every 7 tests. Dr. Christ, we all heard you say, we can't stop the spread. So again, what is being done to stop this spread?
What we've done in terms of the preparation and gradual reopening of our economy to be prepared for the virus, which is with us, there will not, in the foreseeable future, eventually there will be a cure. There isn't one today. There isn't a vaccine. So we need to find a way that we can care for our citizens that need it, that the people that are the most vulnerable understand the harm's way that they are in, and that we can continue other issues while protecting as many people as possible.
So what would you say to the 36-year-old Tempe mom I spoke to this week? 2 kids. She thought she was going to die. Fortunately, she's healthy. She came out of the hospital after 5 days under oxygen, but she has liver problems that she's going to live with. As you know, there are problems that continue beyond this. So is that just the way it's got to be for Arizonans? Because, as you said, we can't stop the spread?
Well, first I would say I'm thrilled that she's alive and out of the hospital. And what we want to do is make sure that anyone that gets sick has care inside a hospital, and of course, where possible, where someone can avoid the contraction of COVID-19. We want that as well. That's why we're talking every week and every day about this. That's why we're putting information out. That's why we're going to continue to stay vigilant.
The question is, what are you doing? And if I can, I want to just quote Scott Gottlieb on CNBC, former FDA commissioner. He said of Arizona this morning, they haven't really been able to take effective public health action yet.
The information that was out there nationally was inaccurate. Now you have the accurate information, and the citizens of Arizona have the facts today.
Thank you, Brad. We're going to go to Zoom next. We're going to talk with Rachel Linegang from the Arizona Republic. Rachel, go ahead.
I'm wondering, did your office solicit that letter from the Hospital Association? And then you mentioned that you believe mask wearing is good, but your posts on social media are never showing you in a mask. Do you not have a responsibility to set an example by wearing a mask when you are appearing in public?
So first I want to say wearing a mask when you can't social distance is good, and I'm going to wear a mask when I'm in those situations. And the first part of your question was?
Whether you solicited the letter.
Oh, listen, there was a lot of national news today, and my phone was ringing off the hook on what was going on in the state of Arizona. I knew what the numbers were and what the facts were. We reconfirmed them with the hospitals, and now we've communicated them to all of you and your media outlets, along as the national, as well as the national news, so everyone today knows that Arizona has hospital capacity. We've got the facts straight. I did not solicit the letter.
Go ahead, please.
Excuse me, gentlemen.
Thank you for calling us, gentlemen.
As you are. I have 2 questions. The first is a very simple yes or no answer. I went to the ADHS dashboard this morning. We have COVID-specific inpatients, 1,291 inpatients. That is a record high. ICU patients, we have 429. Third day in a row, over 400. ER patients, 848. That tied the record. Are these numbers the facts?
Yes, so those numbers are self-reported by the hospitals, so those are a self-report. And we take those from the hospital and upload them to our website.
And if you don't mind, a non-COVID question. Obviously, the protests are continuing across Arizona. There's one in Tempe today. Governor, last week you said that you were learning when we asked about whether or not you understood the concerns of the ministers about racial bias, especially in policing, and their deep concerns. What at this point are you spearheading to try to reduce the tension and make real reform in policing here in Arizona?
So the first thing I want to say is I want to thank the peaceful protesters around Arizona. They have certainly gotten their voices heard. I know they continue to focus on this issue, and rightly so. I've met with leaders in the minority and African American community. I'm going to continue to meet with leaders, faith leaders, additionally tomorrow. We're going to focus on some things at the state level, some things that were in my state of the state before the legislative session closed up. Most notably in terms of body cameras for all of our DPS officers, but there's additional things that we can do around AZ Post, its training requirements, the diversity of that board, a focus on COVID-19 mobile training inside the community, and my Colonel Heston Silbert is also reaching out to the community. We do want to start in terms of law enforcement and the reforms that we can make at the state level, and I think we're really blessed with leaders like Jerry Williams and Chris Magnus and Mark Napier and Paul Penzone that all want to help on this front and these issues. And I want to say to the men and women in law enforcement, Phoenix PD, Tucson PD, our sheriff's offices, our National Guard, along with our peaceful protesters, Arizona will be a better state going through this and going forward.
We're going to go back to Zoom. We're going to go to Dylan Rosenblatt, the Arizona Capital Times. Dylan, go ahead.
Governor, so you said that you specifically did not solicit the letter, but did anybody of your staff solicit the letter?
We got the facts on hospital capacity from the hospitals.
Your office solicited the letter then?
We did not. We have the facts, and it's in letter form. That should be part of the correcting the record for all the misinformation that's been put out there statewide and nationally regarding Arizona.
We'll go back. We'll go to Bob first. Hold on. Bob hasn't had a chance. You vote.
It's misinformation. What needs to be corrected? We want to know what
We have hospital capacity in the state of Arizona.
We're just coming back. You guys have all had questions. And then
So I think a couple things that you can probably clear up, Governor. On Friday, Banner said their ICU was at capacity and that they were nearly over capacity. And then on Tuesday and Wednesday and Thursday, Tuesday and Wednesday, hospitals went over 80% of capacity according to your executive order. That's a metric that stops elective surgeries. We were at 83% Tuesday, we're at 84% yesterday. That's the most current numbers. Which I wrote about, and that means that hospitals are nearing capacity. They have to stop accepting new patients for elective surgeries. And that's not false information, Governor. So that shows that there's been a growth in cases. And could you address whether you're going to change your executive order so that we...
No, my executive order is going to continue to stand. If we were to see a hospital capacity that was in the alarm rate, elective surgeries would stop. And you want to address how this misinformation got into the bloodstream? Can we get the answer, please? Thank you.
That's your own metric. Your order
Okay.
says 80%, your dashboard says 84%. It's not hard.
So as we look, when we work with the hospitals and we're verifying the data, so the data that was presented on Friday didn't match what we had reported to us. We continue to work with the hospitals, so it's on some hospitals, they need to maintain 80% capacity from a system-wide perspective, and some hospitals have chosen to do it on a hospital-by-hospital basis if they're a system. So what we're doing now is we are working through the data to see if there are any that look like they're over capacity, we are going to be working with them to either bring them back down or get them into compliance. They will have time to dispute the data if they've had a different, like if they feel that the data doesn't accurately represent where they are. But they did attest to the fact that they would maintain capacity at 80% or below.
Okay, so let me, a related question. So Maricopa County yesterday said that 27% of their cases, which is thousands and thousands of cases, have come in the last week. Typically, it takes 2-3 weeks for somebody to get sick enough to be hospitalized. Are you concerned that the surge in new cases that we're seeing is going to hit our hospitals in a week or two, and then they'll be at 100%, or have to go into surge capacity? Because that's, I think, what the medical experts around the country are concerned about.
Well, let me address and say, from the standpoint of COVID-19 in Arizona, we are concerned every day that we have the proper capacity and resources. That's what we've been working on for 3+ months in the state. That's what we're partnering with the hospitals on. And it's my belief that come what may, we have capacity. And we are seeing an increase in our cases. We pointed it out very clearly. We do have hospital capacity beyond that, and that's what's most important in the CDC gating criteria.
It does put us into crisis care when we're above a certain level, though, which you're trying to avoid.
We are not at a crisis care.
I know.
Okay, we have hospital beds, ICU beds, and ventilators.
Thank you, Governor.
Well, let me put a finer point on this, because let me ask Dr. Christ, because you made this point. Are you telling me there are no hospitals or hospital systems today that are at or above 80% capacity?
So we do have hospitals that in one or both metrics may have reported. It could be a day-by-day basis, so that's what we're going back and looking at.
So have you ordered them to stop elective surgery?
So we have been working, so Howie, with licensing, we are always pro-compliance. So we are working with them. We will be reaching out and having them tell us whether that data is accurate. Now, it's self-reported data, and then we will be working with them to see if that's something they can bring back down into capacity and what type of resources they have available.
Since national media and national experts have the facts wrong, as you say, at what point will you be convinced Arizona is headed in the wrong direction? What's it going to take for you?
Well, my focus is, one, I'm listening to the experts inside Arizona that serve the people of Arizona every day, that have helped navigate through this so far. The good people at the Department of Health Services, along with Dr. Christ, have steered us through H1N1, Ebola, and the last measles outbreak. So we're focused on Arizona, and I don't know how many times I have to take you through the metrics. They're not my metrics. They're the Center for Disease Control and Prevention metrics, along with the White House gating criteria that have been given to every other governor, and showing you where we are on our symptoms, our cases, our testing, and our hospital capacity. And today, we have hospital capacity, and we have not tapped our surge resources or field hospitals. So we want to continue to monitor this, be vigilant where we can, reduce it, and that's possible. So it's going to be something that we continue to educate, communicate, and fight every single day.
Arizona's breaking its own records, though. It seems like you don't see this.
I just took you through
the fact that we have capacity. That's all you're concerned about.
No, that's not all I'm concerned about. That's what's most important when there is a rise in cases, because a rise in cases could result in a rise of severe illness that required hospitalization. I want every Arizonan to be able to have the medical care and comfort and resources necessary, and today we are able to provide that.
It means more lives lost.
Telewindow, please. Telewindow.
So if Banner was saying that they were worried about reaching capacity, what changed this week that now they're, saying otherwise? Also, is going back to a closure of the state off the table for you if the cases do go up and the hospitalizations do go up again?
Well, the first question sounds like more of a question for Banner, unless you've got some information on that. And like I said, we're going to, there was no announcement that was made today around reopening. We're going to focus on staying vigilant and proper hygiene going forward to mitigate this. Do you want to add anything on Banner?
So Banner has a lot of facilities. They do have capacity within their system. Obviously, some of their hospitals may be more impacted than others, but we're working very closely with Banner.
So going back to a closure of the state, is that off the table for you right now?
It's not under discussion.
We're going to go ahead. Andrew, we'll come over here.
Are you going to support the Secretary of State's proposal to move the Confederate monument in front of the Capitol into storage at the Capitol Museum?
So that was a letter that was sent to the Department of Administration. I've said that there's a public process to be able to put something in Wesley Bolin Plaza or on state property. I think there should be a public process if someone wants to go the alternative route. I haven't been a fan of removing monuments or memorials, and certainly not because a letter was written, but I also think there should be a clear public process for people that would like to pursue that. I think there should be a public process.
We're going to wrap it up. Last question here, Jason Barry.
All right, real quick, Governor. Do you feel like too many Arizonans have fallen into a false sense of security, or maybe a little apathetic when it comes to social distancing, and that's one of the things that's contributing to our high numbers? I mean, do you feel like there are too many people that have thought, you know what, this is behind us, but the numbers keep going up? I mean, what's your message to Arizonans who may think, you know, this isn't that big a deal, I don't maybe need to social distance, I don't need to wear a mask? I mean, we're seeing this news stories all over the place, people not social distancing, not wearing masks. I mean, that's a problem that's contributing to the numbers.
So my message is to Arizonans is to stay vigilant on this. We need to stay focused on making sure that our citizens are safe and that we continue to navigate through COVID-19. The things Dr. Christ pointed out about when you can't social distance, first and foremost, social distance, but the face covering, washing your hands, staying home when sick. Let's redouble our efforts on that. I think part of it is, one, Arizonans have been terrific, as good as any people in the country in navigating through this so far. But it is human nature. People want to get back to life, and I understand that. I want that as well, but I want as many people to be healthy. I want to avoid as much sickness as possible, and certainly save as many lives and care for the people that are sick. So that would be the message in closing, is that Arizona has hospital capacity, but let's refocus our efforts on washing our hands, social distancing, covering our face when we can't social distance. And if you're sick, please stay home. And if you've got the opportunity this weekend, and especially if you've been out and about quite a bit, go and get a test. That information, that data will help us and inform decisions going into the future. Thank you, everyone.